episode of Talking with Docs. I am Dr. Paul Zalzo.
And I'm Dr. Brad Weaning.
Quick one today.
Okay.
We're just going to answer the question which I get asked in the office quite often.
Yep.
When can I fly after my total hip or total knee replacement?
Like you're a pilot?
No.
Okay.
Or a bird.
Okay.
No.
Okay.
I mean, like, when can I go on a commercial flight?
Okay, yeah. I would say particularly in Canada, when people get their joints replaced in the winter, they want to get their joint replaced and then they want to snowbird it down to Florida or some other location. So very, very common question.
I'm going to precede this by saying there's not a lot of good scientific evidence to help guide our answer.
Yeah.
But I think many orthopedic surgeons generally say roughly the same thing, even though we don't have great evidence.
I would totally agree with that very non-committal statement.
Okay.
So what,
what do you say?
So what do you tell your patients?
I say like the magic number is about 3 months. I always say 3 months.
I would agree.
And then we work around that depending on what the trip is. Are we talking about flying, for an hour, or are we going around the world in 80 days kind of thing? So,
is it like a 5-star all-inclusive? Is it like a big anniversary?
Yeah. How important is this?
My patients lobby me hard, for sure. I totally agree. So 3 months. Now, total knee, total hip, would you say exactly the same?
I do. I say the same thing.
Yeah. And to be honest, I would agree with you. And I worry for different reasons for my hips and knees. For my hips, I worry that they're going to dislocate potentially on the plane. I actually had that happen to a lady once.
Really?
Who went before I told her she was allowed, and she went to Calgary and she dislocated on the tarmac, had to be transferred off the plane and then reduced, and ultimately, unfortunately, had to go on to have surgery.
Okay. That's not a good scenario, but I think the most common thing that we worry about is a blood clot.
Yes.
A deep vein thrombosis, a DVT,
Yep.
which is a clot in your leg, which is fine if it stays in your leg, but if a piece breaks off, it goes to your lungs, it becomes a PE or a pulmonary embolism, and that can be fatal.
Right, so the majority of people have anticoagulation for the first 2 weeks, but what happens, and probably more than we even know, is after those 2 weeks, people probably have small little clots brewing that are subclinical, they don't cause significant symptoms, and then if you get on a plane, maybe that subclinical one becomes a clinical one.
Why? Why on a plane? Because on a plane you're sitting there immobilized for a long period of time, so you're not pumping blood out of your legs, you're not walking around, your veins aren't pumping blood out of your legs.
And I think that's what people don't realize. So when you're walking, every time you push off, your calf muscles squeeze those veins, and they have one-way valve, so the blood gets pushed back up to your heart. So sitting there doesn't do it.
Sitting there is what makes it clot. And the other thing is, in a plane, the cabin pressure is a little bit less than atmospheric pressure. That's why you see stewards and that they won't let a kid take a soccer ball on a plane. They always deflate it because they're worried it's going to burst because the pressure outside is lower, so the soccer ball gets bigger and bigger.
Interesting.
Same thing with your legs, right? Because you've got a bit of swelling in there. Atmospheric pressure is less, so your swelling will get worse.
Yep.
And then your blood will pool more, and that makes you increased risk of DVT. What can you do to help with that?
So I tell people, if they're not normally on an anticoagulant for some other medical reason, to consider taking aspirin the day before they travel, the day of their travel, and the day after they get there.
I tell people the same thing. Again, we don't have a lot of evidence to help guide us. Or you can wear
compression stockings, which people love.
They are uncomfortable.
They are
so uncomfortable, but you eventually get used to it.
Yep.
A DVT is uncomfortable, so just compare that when you're thinking. And you wear these compression socks, and that helps equal things out because the atmospheric pressure is higher, so the cabin pressure is lower than atmospheric. Then if you put the compression socks on, it'll help bring that closer to a normal pressure that your legs see.
And I was going to say, try to get up from your seat every now and then. If you're that window seat, that's really awkward. You're waking the person up beside you maybe, but it's important at least to get up once on those flights, to get up and move around a little bit. Captain,
put on the seatbelt sign. Nobody leave your seat.
That's right.
This has happened to me where I really, really have to go to the washroom. Okay. If I'm on a flight where it has free beer and might have had 1 beer or 2 beers, now I really got to go to the washroom. But that seatbelt sign is on. What do you do?
I think you got to listen. You got to put that seatbelt.
I say, look, I just had a knee replacement. This is a matter of life and death. I have to get up now.
That's right. Most importantly, for sure, discuss this with your surgeon beforehand. And then I'd say the other thing about flying is you want to discuss it with your insurance company, because they all have riders about pre-existing conditions. So sometimes it's 90 days, sometimes it's 60 days, 30 days. You want to make sure that if you end up with a problem related to your knee replacement or your hip replacement, that it's going to be covered by your travel insurance.
And the other thing too is, You know, after I've replaced your knee or hip, I don't want you to travel right away because I want to see you. I want to see you and follow up, make sure everything's going okay, take out the clips from the surgery, check the wound, check how you're doing.
Make sure you're focusing on your rehab, that kind of stuff.
Yeah. So if you get your knee replaced or hip replaced and you take off, we can't follow you up very well.
Yeah. Okay, so if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own travel plans and you are in charge of your own health.
We'll see you next time.